So in this video we'll be talking about the course of cranial nerve 7, that is the facial nerve, and the branches it gives off. So to orient you to the 3D model, this is the right side of the skull, and this is the left side of the skull, and in the right side I have removed the parietal and the temporal bones such that you can see the brain stem. So this here is the brain stem, this is the midbrain, this is the pons, and this is the medulla oblongata. And we can see one nerve coming out from pons, and then it is further giving off three branches, this branch and this branch. So this is the trigeminal nerve giving off the ophthalmic branch, the maxillary branch, and the mandibular branch. Now if we see a little inferiorly, we can see two nerves coming from the pontomedullary junction. So this is the pons, this is the medulla, and this here is the pontomedullary junction, and we can see two nerves arising from pontomedullary junction. So one is the cranial nerve 7 and one is the cranial nerve 8. So if we rotate the model, we can see that this here is a ganglion. So this is the geniculate ganglion, and we know geniculate ganglion is the ganglion of facial nerve 7. So this must be the facial nerve. Now the facial nerve uh, at the geniculate ganglion gives off a branch which is known as the greater petrosal nerve. So this is the geniculate ganglion, and we can see a branch coming out and going like this. So this is the greater petrosal nerve. We will come to greater petrosal nerve later. Uh, Now we will move on to the other branches. So the facial nerve also gives off other branches. So this is the posterior auricular branch or the posterior auricular nerve. So we can see the posterior auricular nerve ascends over to the temporal area, and it supplies some muscles. So what are these muscles? These muscles are auricularis muscle, the occipitalis muscle, the posterior belly of digastric, and the stylohyoid muscle. And the stylomastoid foramen has not been shown here, but the facial nerve exits out through the stylomastoid foramen, and it fans out giving off 5 branches. So these 5 branches are this is the temporal branch. So we can see that this branch is going over the temporal area. So this over is the temporal branch. Then we have one zygomatic branch, then we have some buccal branch, then we have the marginal mandibular branch, and then we have the cervical branch. So these are the 5 branches into which the cranial nerve 7 finally divides into. Now as we talked earlier that one branch is given off by the geniculate ganglion, which is known as the greater petrosal nerve. So this here is the greater petrosal nerve. Now we can see that the greater petrosal nerve is coming, and it is joining into this nerve over here. So this nerve over here is the deep petrosal nerve, and the deep petrosal nerve arises from the plexus of internal carotid artery. So this nerve over here is the deep petrosal nerve, and we can see that the deep petrosal nerve, this in red is the internal carotid artery, and we can see that the deep petrosal nerve is arising from the plexus around internal carotid artery. Now the greater petrosal nerve and the deep petrosal nerve join to form the nerve to pterygoid canal. So this here is the nerve to pterygoid canal. This is the nerve to pterygoid canal, and if we trace the nerve to pterygoid canal, we can see it is joining to this nerve over here. The nerve to pterygoid canal is ascending and is joining to this nerve over here. This we talked as the trigeminal nerve, giving off its three branches of thalamic branch, the maxillary branch and the mandibular branch. So the nerve to pterygoid canal is coming and joining to maxillary nerve. Now the maxillary nerve is giving one ganglion. Ganglion is hanging from the maxillary nerve. So this here is known as the pterygopalatine ganglion. So this here is the pterygopalatine ganglion, and this pterygopalatine ganglion is giving off these branches. So these branches are the ganglionic branches. So these are the ganglionic branches, and if we further trace these ganglionic branches, these will go to the lacrimal glands and to the nasal mucosa, and nerves, these ganglionic branches will supply the mucous glands of the nasal mucosa and of the lacrimal glands. And so this pterygopalatine ganglion is also known as the ganglion of hay fever, because during hay fever the lacrimal glands and our sinuses act up, and it leads to watering. So this is the pterygopalatine ganglion. Now we will see the other branches of the facial nerve. So now we will see the other branches of the facial nerve. So this here was our facial nerve, and we saw that it was giving off the greater petrosal nerve. This is the facial nerve, and here we see that it is giving off another branch. So this here is the cauda tympani nerve. So this is the cauda tympani nerve. Now we can see that the cauda tympani nerve descends inferiorly, and it is coming to join this nerve over here. So the cauda tympani nerve is coming to join this nerve over here. So this nerve is uh, the lingual nerve, and the lingual nerve is a branch of the inferior division of mandibular nerve. So if we rotate the model, we can see that this was the maxillary nerve and this was the mandibular nerve, and the inferior division of the mandibular nerve gives off this lingual nerve. So this is the lingual nerve, and the cauda tympani comes and joins this lingual nerve. Then the lingual nerve descends inferiorly. This lingual nerve is descending inferiorly and inferiorly, and we can see that there's one ganglion hanging from the lingual nerve. So this ganglion over here is the submandibular ganglion. So this is the submandibular ganglion, and this submandibular ganglion supplies the submandibular and the sublingual salivary glands. So this finishes our video on the cranial nerve 7.